I'm Randy Olson. I am the program chair here at Globe University for the massage therapy program.
And I'm Toby Mulvihill. I'm the full-time instructor for massage therapy. We are here today to show you a few basic intro techniques that you can use over and over and over, and watch it right here in this video. What I want to show you guys is how to wash your hands. Seems very basic, but a lot of steps we do end up forgetting. First thing, we absolutely do want to start with some warm to hot water. It actually helps loosen the debris better than cold water. So we have our water running. This guy likes to splash on me, so I'm going to rotate it over a little bit. You need to use soap instead of hand sanitizer. Lots of soap, not just one little pump, but if you have these foam dispensers like we do, a good four or five pumps. That way you can get your entire hands covered. Now, I'm going to start by covering my entire hands, and then also work my forearms, because we do use our forearms in massage therapy as well. Now, a good idea is to go through a 20 count or so, or say your ABCs to yourself. So, you get the idea, right? Now, what I'm doing is also including my fingernails. That way you can actually make sure that when you are touching your client, no extra debris is underneath of your fingers as well. Once you got yourself good and soaked up, we're going to go ahead, check our temperature. Try to contain all the water in the sink as much as possible. And then again, be sure to get your forearms included here so you wash off all that extra soap. Again, with the fingernails, make sure that you wash those out. You can slick down the extra water, give a few of these. Make sure to grab a towel first, and that way you're not contaminating your hands again. 2 towels, make sure to wipe off your forearms. And go in between. If you need more towels, don't be afraid. Super easy. Right in the disposal afterward, and then you're good to go into the next part of your process. All right, after you've washed your hands very thoroughly, now you're ready to begin touching the equipment that you're going to be using. Now, as you can see, we have all of our linens and all of our tools ready in an easily accessible place. Usually in your own practice, it's going to be in a confined and closed area, but since we are in the classroom, we have everything ready right away. So a basic table setup that we're going to be using is optional. Your table warmer, which is down here. We have pillowcases, blankets. We also have fitted sheets that have the little elastic ends so they go right on the table. And then also our flat sheet. Now, if you're using a special modality, sports, geriatrics, pregnancy massage, these things, you also have pillows that you can use, which obviously you do want a pillowcase for every pillow that you are going to use. For our basic table setup, we are going to need, I'm going to skip over the table warmer today, but we definitely need fitted sheet that goes down on the table first, a flat sheet, which goes right over the top of that, a blanket, which will go on top of the flat sheet, and then a pillowcase. And we use pillowcases in lieu of fitted face cradle covers, and that will go right on top. Now you have everything right here. You can go ahead and when you get over to a table, put your stack right down so you can work directly one sheet to the next. Alright, now that we've washed our hands, gotten our basic linen set for our table, we're going to go ahead and get this started. Now, usually all of our stools are directly underneath the face cradle of the table. So what you can do when you have your linens is just slide that out. Again, we have the pillowcase on top, so we flip it right on over. Makes an easy transition for you. This way, you can just pull linen to linen and start dressing your table. Now, as you can see, this table is not a very good working height for me. I'm going to be reaching over and leaning way too far. It's going to create bad body mechanics. So what we need to do first, before we dress the table, is make sure that we know our table and how to adjust it. Alright, so the easiest way to make sure to adjust your table to a good working condition for you is to bring the table right up to your knuckles. So with this table, I need about 3 or 4 inches height. Now, every table is a little bit different, so you will have to get used to yours before you start working. But with ours, we have either a 1 or a 2 spoke system. Super easy to adjust. First thing that you do, these knobs right here, lefty-loosey, they come right off, okay? You can stabilize the table, and they will come right out. I'll just adjust that up a few extra steps, and boom. Now, easy way to get these back on is hold with your thumb so it doesn't go wobbling all over the place, and then start screwing back on. Now, to get this nice and tight, don't just use your fingers, use your whole hand to really grip that. That way you have that nice and stable. Now if we look, that'll be probably about right for me. Go to the other side, repeat process until all of them are the same. Now, how do I tell which spoke to use? I count from the bottom up. 1, 2, 3, 4 are showing. The 5th one will be where I place it. 1, 2, 3, 4 are showing. The 5th one, I'll place my thumb on. And then adjust the other side because obviously we don't want our clients going topsy-turvy. Ready, set, go. Now that we have our table adjusted, it's time to actually dress the table. First things first, our fitted sheet. Now as you can tell, we have a cleaning service that goes through and makes all of our sheets folded all pretty. Now, the easiest way to take care of this is to use your table as a working surface. Just draw out. This way you don't have to fluff anything, spread germs and other linen particles into the air. When you have the inside exposed, make sure to look for the inside lip. And the nice smooth flat one will be your outside surface. Place by place. Now I like to start at the foot of the table, not at the head of the table. This way you can make adjustments as needed. Put the elastic ends right around the back. Make sure that it's pulled tight. Go up to the front, right over the ends. Don't worry about where the face cradle comes in. You can adjust that at any time. People have the largest problem with the flat sheet afterward, so again, we're going to pull it right on out. Now as you can see, there's 2 parts. We're going to reach for any one of them and just roll up in your hands. That way, again, you don't fluff out the blanket or the sheet. Once you have a majority, you're going to go ahead and go across. Now, obviously, we're a little uneven here. The easiest way for me is to come back to the head of the table, grab the top of the sheet, one end in each hand. This way, you can stand right in the center and make sure that it goes directly center. Yes, it'll be a little off, but when you come to the foot of the table, again, find both ends, reach out as far as you can. You can pull slightly and make sure that you're in the center of the table, right on down. That should create an evenness, and don't ever trust the center crease line. Maybe they got folded wrong. Every blanket is going to differ a little bit. Some are shorter, some are longer. But again, same basic method. Find the open end, let it unfold right over the top. And what I like to do is to make sure that this blanket line comes and fits right on the sheet. Now that everything is smooth, the easiest way to get all the wrinkles out is Start at the foot of the table and go in one direction up. Start in the center, brush out. Come over, again right in the center, from the center out. And the last part to making a table look good, make sure you have both the flat sheet and the blanket. Pull them tight and fold just enough where you get about an inch of the table exposed. Once you have that nice and flat, you can pin one side right at the corner where it meets the edge of the table, grab the other side, and do a simple fold. It adds a lot to the presentation of your table. Last thing, pillowcases. Fold directly in half the hot dog way, and there's several different styles that you can use. Easiest for me is to just place one end down, fold one over, and make a little hole in the center so people can actually breathe. There you have everything set up, and your table is ready for your client. All right, now that our equipment is all set up, we're going to go ahead and make sure that we section off an area of the classroom so that obviously no exposures happen to other clients. Easiest way, we have these rolled up so they're a little bit easier to maintain. These clips here, just go ahead and squeeze it in, pull it on out, and make sure that you find the edge, the leading edge, and walk it right around. Now, when you're starting, you can usually leave a space open for your client. But when you are walking around, sometimes they do get caught into the gliders. Now, if that happens, you want to make sure to pull from behind the area that you're working on, so that way you get the full transition. All right? Be gentle with them. They're not 100% foolproof. Pull it all the way closed. Make sure that both sides are even. And if you are working in an area that needs to be clipped, again, find the edge, fold it onto itself, and clip. Easy. Now that you have your entire equipment and station set up, it's time to meet your client. Make sure you have their client file with you, and put on a smile. Hey Randy, I'm Toby Mulvihill. I'll be your massage therapist today. How are you doing?
I'm doing well, thanks.
Good to hear. All right. Obviously, you've been here before. We filled out all the paperwork, but I do want to review with you and make sure that everything is up to date.
Okay.
Now, is your name, address, emergency contact still up to date?
Yes.
Good deal. In a brief review of your medical history, has anything changed? Do we need to update anything?
No.
Perfect. All right. Since that is the case, we've reviewed. I'm going to have you initial and date since we did update this. Perfection. Thank you very much. All right. Last time that we worked on you, this and this and this condition. Is that still going on?
Well, there's still some pain in my neck and...
Okay. Is there anything you want to focus on specifically?
Yeah, if you could focus on that area.
Right there. Got it. Okay. Today, we are going to be performing a 60-minute full-body deep tissue massage for you. I will focus into that area, into the right shoulder for you, see if we can't get some more range of motion. Do you have any questions before we begin?
No.
All right, cool. If you want to follow me in, we'll be right in here.
Okay.
All right, Randy, right this way. So this is going to be our treatment area for today. So as you can see, what's going to happen is this will be closed off. Obviously, you'll have your privacy. What we're going to do is I will leave the area. You are going to dress down to your comfort level, whatever that is. Now, usually we do have hooks on the wall for your clothing. With this, since we don't, just put it right underneath the table. That way, I'm not tripping all over, okay? Once you're dressed down to your comfort level, I'm going to have you start face down in the face cradle. You're going to be underneath this top sheet here, okay? Make sure to get comfortable, and when I get back in, we'll put a bolster under your ankles. Make sure to relieve some of that back pressure for you, okay? Do you have any questions?
No.
Awesome. If you can remove any jewelry that might get in the way of the massage, if If you have anything that you need to keep on, that's totally fine as well. Okay?
Okay.
All right, you take your time. I'm going to go ahead and close you off here. And I'll be back in just a few minutes for you, okay?
Okay.
Thank you. All right. Now, when your client is undressing, there's a few things that you do want to do. First, go wash your hands again. You've been touching a lot of outside materials, and we need to make sure that nothing is contaminated. So obviously, use your hand washing practices. Afterward, you want to make sure to get whatever emollient you're going to use, whether it's oil, cream, anything that you choose. Make sure that your holster is adjusted so that you can fit it correctly the first time and get ready. When you are already set, you know that you have everything for your massage, it's time to go ahead and introduce into the client again. When you get outside, obviously knocking isn't going to do much on these drapes, so you say, Randy, are you already set?
Yes, I am.
Excellent. Well, that way we can see everything. Now the first thing that I do when I get into the room, I always give them a bolster under their ankles or under their knees, depending on which side they're on, because it does help with back pressure and it makes them feel more at rest. So your bolsters are usually right underneath the table. Side note, please never, ever put the bolster on the ground when you're done with it. Randy, would you like a full or a half bolster for under your ankles?
A full, please.
A full bolster. Easiest way for me to put the bolster under the client is go all the way underneath the fitted sheet, in between the fitted and the table. Slide directly underneath the client, right under her ankles, and go right under your arm. Is that okay?
Yep.
Excellent. Make sure that your client is comfortable for where you placed it. And also, make sure that the bolster is even on the table so one side isn't hanging way off and it creates an imbalance. Side note, if you do have a table warmer on the table, make sure that you put the bolster in between the table warmer and the fitted sheet. This way, they still get some warmth instead of disassociating their skin with the warmth. Alright, now that you have the bolster in, it's time to begin the massage. Personally, I like to start from the shoulders and work down. Then when you flip them over, work from the legs back up. It's a routine I have, you make your own. So from here, first thing that you want to remember is, once you start having any contact with your client, continue that. Make sure that you always have a hand on them, okay? So to get from here to there, go along the side. This way, you don't have to worry about any glute contact or making them feel uncomfortable, all right? Back up the side. Now, when I'm walking forward, I notice that my sheets from the client either getting on the table or me doing anything with the bolster is just a little bit unfurled. So, I like to have a nice table. I just focus on making them even. From here, you can go from the adjustment right into your grounding with the client. Make sure that they know your touch before you just start working on them, all right? Deep breath. Clear your mind. If you want, this is a great opportunity for you to make some contact and communication with your client by saying, all right, Randy, I'd like you to take a nice, slow, deep breath in. While she is, you breathe with her, and go ahead and exhale. One more of those. Now you've made contact, communication, the client feels your touch, and you're ready to begin the massage. Now obviously, the first thing that you can do is either expose or do a walkthrough with your hands. This is a general assessment, so you get a feel of what you're going to be working with, and also so that you can see exactly how their body responds to your touch. Once I've done that, I take out the top sheet because we want to expose the first layer only. Okay? Don't worry about putting this over, they're not going to really feel it. But if you want, you can keep it right at their neckline. So we grab the blanket. We are going to pull across the body until you can see where their belt line would be, okay? So we pull down, and that's an easy transition to make. Going from here, switching hands, pulling down right to the belt line. Now, it might take a few tries for you to realize where a belt line is on your client, and don't worry, if you have too much or too little, you can always adjust. So from here, we make sure that it's flat, not lumpy. And at this point you say, all right, I'm going to tuck this sheet into your underwear line, 1, 2. Just simply 1, 2, that way you're not prancing all over and making them fidgety. This is going to help you with security, and we won't get any oils on your undergarments. We grab the sheet, pull up, get it around the top of the table, and again, pull right to that tuck line. Now you have a good working area. Now as you can see, there's air exposures here and here. Now, I prefer draping from the opposite side because it's easy to tuck underneath instead of worrying about doing it same side here. What we do is we hold right at the drape line, make sure to pull the bottom fitted sheet away from it so it doesn't roll up while you are doing the tucking, okay? So we hold that, and with your scooping hand, you have the start of your hand and the finish. The start goes right in between their arm and their body. Holding, holding, and then you simply scoop underneath. You should feel their hip bone right underneath of where your end of your tuck is. Again, that's just one tuck. Follow across the back and do the other side. Again, switch hands, one tuck. At this point, if you need, you can do an extra tuck along the underwear line. And note, not everybody will wear underwear. You don't need an underwear line to make this nice, clean tuck happen, right? This allows you to get right towards the sacrum, and it allows you to work the posterior, superior iliac crest, okay? When you have everything exposed, you can start working the back directly. You can also go right to the elbow, pull up, and have the arm. Same thing over here. Go ahead, boom. Side note, a lot of clients will be confused, especially if they are first-time clients, on where to have their arms. Now, there's several different positions that you can do. Each are totally acceptable, but you as the therapist have to let them know you will end up moving them around wherever you need them for the working that you're doing. Area 1 is right along the side. They can have them flat down this way when they are in a prone position, face down in the face cradle. They can have it, and if they have shoulder problems, this might be a problem for them. You can either boost right underneath the shoulder with a rolled up towel, or you can have a pillow for under their chest, especially if they are a larger chested woman as well. Now, the other position that some people like is, if I can seal your arm, right hanging to the side here. I personally like this, but it's totally up to you. And the client can just free hang just like that. On both sides, one side, whatever's most comfortable for them. The last thing, since we are at Globe, we have the nice little add-on feature, and move your hair here, of these armrests. Now, some people joke around that these are drool catchers as well, which, hey, I don't blame you. Sometimes it's a really good massage. But for the most part, you can tell the clients, hey, if you just want to sneak your arms right into there, that way, whatever is easiest for you. If they don't have an arm holder, you can certainly have them placed right down in front. Whatever is easiest for them and most comfortable. Hanging your arms like this may get a little bit hairy sometimes because it does impinge some areas, so they might have to move every once in a while. But those are some different positions to make the arm a little bit more comfortable. All right, now you've completed the upper extremity going from not only the back, but working both of the arms as well. Make sure to finish the close. Whatever that is, if it's rounding, if it's light feathering strokes, if it's simple crossover, make sure that your client knows that they are finished here. Once you're done, walk to a side, grab right underneath the elbow, and be able to guide their hand underneath that sheet combo. Elbow, hold it up, there we are. At this point, I grab the end of the sheet. Now, make this as simple as possible. Grab across, hold directly up along the client. Now, you'll see this is still tucked in. I have not untucked it. It's unnecessary. Get a good firm grasp and pull directly up. Go to the sides of the sheet and pull out. And they go right out with you. Hold, grab the blanket, go ahead and expose just to here. If it is cold in your working room, you can cover them up, whatever fits you best. At this point, you're free to transition again on the side of the body to work into the legs. Now, legs, exposing them, very easy once you get used to it. But it can be a difficult maneuver, so make sure to watch the next part a few times over until you get it. For the leg draping, it's about 6 steps, and they should all be very fluid. Now, the first thing is you transition to the feet. Again, we want to work from the top layer down. So, granted, yes, we are only going to work one leg at a time. Get the blanket out of the way right away. So grab across the entire bottom of the blanket. We're going to lift up and transition that arm. Okay? And we're going to go right to where the gluteal cleft, the bottom of the glutes meet the actual hamstring. This way, no exposures happen, and the blanket's completely out of the way, so you can work the entire leg. Once you have that down, and again, it will probably take you a few tries to get where that line is supposed to be. You've placed it. Now, I work from the side of the table instead of from the foot of the table. It allows me a way easier option for me to actually have control of the sheets. So what I do is, you can tell where the knee is. You can tell where the ankle is. One hand goes at the ankle, one towards the knee. I reach the bottom of the sheets, and I roll them up, as in I were doing a come here motion, right? So I roll them all in a line. As you can see, it's a nice straight line right here. And I expose at the knee, right in between the legs. Now, that's step 1. Step 2, we want to actually do a tuck underneath. Now you have this nice big jumble of sheets. You don't want to just tuck that underneath. You want to have a very smooth surface layer for the client's leg to rest on, because if it's there for a while, even the littlest amount of clumped sheet will end up feeling uncomfortable after a while. Easiest way to do that, we've exposed, keep holding where it was, pinch, and keep that holding hand stationary. Pull with your other hand to expose just the edge of the sheet, okay? From here, when you have that edge of the sheet, you're going to go ahead and make a 3-to-1 ratio scissor so you can do an easy tuck. That scissor you keep hold of and place on the inside thigh right above the knee. You're going to go ahead and scoot the sheets about halfway up the thigh. From here, this is where people get lost. Your outside hand that is not holding and not doing the tucking underneath is going to support the leg weight. Scoop from under the knee all the way to the ankle. Now this, you're going to have to get a lunge so you're not doing one of these, okay? Once you have that support, in one motion, you're going to lift with the support hand and tuck with the tucking hand. All right? One fluid motion to right here. Now you're still supporting, and you've got your arms kind of in a crisscross like this. Transition the weight. Now this hand is free to do anything. Go ahead and hold under the knee so that your client is not uncomfortable, and go ahead and pull it up. As long as you've got that sheet tight against the leg, it's not going anywhere and you're not exposing. Pull up, and as you can see, you have to be wary of their hand. Pull all the way up, and that way you can scoot the sheet up. Last two things, make sure that your sheets are nice and straight. And with this, you can either tuck around their hand, you can ask them if they want to hold onto it, or from here, you can find your fitted sheet and kind of scoot and shimmy in between their thigh and their hand and do one tuck underneath. Right? This way, you don't have any air gaps here, you don't have any air gaps here, and you have the entire leg that you can work through. Right? When you are done, it's the same process in reverse. So we started here. I'm not going to untuck. I'm just going to do the support. The bottom sheet that you've tucked through, you're simply going to pass that on the inside leg right to the foot. We support. Go ahead and unfold. And boom. 1, 2, 3. Fairly easy. All right, now I'm going to show you what it looks like in real time. That way you can get an understanding of how it'll look without having to stop step by step. So I've exposed the legs by getting the blanket out of the way. Knee and ankle. Find the edge of the sheet. Up the thigh. Hold. Tuck. And another tuck to get rid of the air gap. If this half of the thigh is still exposed or not exposed, you can go ahead and just shimmy right up. Boom. Scoop, pull, transition, pull out. Make sure that your sheets are straight. Good to go. All right, now that you have completed one leg for the massage and completed the draping, we obviously have another leg to get to. Now, again, we don't want to break contact with the client, so keep one hand on while you do a transition around the foot of the table. Again, we're doing the same process for the draping. You're just going to switch your arms, so the inside will now become the outside and the outside inside. You'll get it. We reach right down, working from the side of the table. We're going to go ahead and make a clean line right in between the legs. Go ahead and find the edge of the sheet. You're going to go ahead and expose half of the thigh. Again, with that outside arm, scoop to support. Tuck, pull. Make sure to take out the bottom linens so it doesn't remain in a clump underneath of it. And at this point, again, you can shimmy right underneath. Now there's no air gap here, there's no air gap here, and again, if you need to, you can expose right up to the glute so you have the full range that you can work on. Again, we're going to go ahead, do our finishing strokes once the massage is complete. Scoop underneath. You're going to have to get down low for this so you're not just doing this. Once you have that, find the bottom sheet that you've tucked underneath, and again, you're going to pull that edge of the sheet directly under and to her ankle. 1. And then with the top tuck here, you can simply pull it out. I like to make sure afterward to adjust the sheets, and again, we need to transition from lower extremity to upper. So we find the edge of the blanket on the outside. Don't just fumble up here for it. You can see the edge of the sheet. Spread all the way across. Make sure you know where you're going. Set it down. At this point, you can transition into flipping the client over. All right, now we've completed the lower extremity massage, and we need to transition our client so we can work the anterior side, the front side of their body. The first thing that you need to do for this is remove the bolster so it's easy for them to get down. Some people leave it in and simply transition. I find that with clients, they don't know how to get over the bolster, especially as a first-time client. So, again, we go all the way underneath all of the sheets, and again, if there's a table warmer here, you'll go in between the table warmer and the fitted. You're going to go ahead and reach for a stable point, all right? If you go underneath their ankles and bend their ankles this way, not going to feel so good, okay? So we want to go directly underneath, make sure you have both of their legs, and again, get underneath the weight so you can simply hold your arm into this motion, not into this motion, okay? Right here, we lift up, we take out, and slowly lower their legs down. A lot of the time, clients will end up holding their legs up like this. If they do, just make sure to keep contact with them so you don't do that, okay? So slowly lower until they make contact. Scoot your hand out. Again, this never goes on the floor. Make sure to put it underneath in the table holding area, okay? Keep contact with your client. Go right up the side, and then you start explaining to them what you are going to do. At this point, I like to say, okay, Randy, what I'm going to do right now is I'm going to hold this side of the sheets, and I actually physically touch them so they know. Because if you're right here and you say, okay, I'm going to hold this side of the sheets, they don't know where you're coming from. I'm going to hold this side of the sheets against the table. I'm going to give you a little teepee or a tent on this side, and again, physical contact while you're explaining. And I'm going to lift this end of the sheets up. I want you to take your time. You're going to end up rolling over onto your back, and I want you, again, physical contact, I want you to scoot towards the foot of the table so that your head is actually on the table, not on the face cradle, okay? And I always make sure that they understand beforehand. So again, I'm going to pin this side of the sheets to the table. I'm going to give you a little teepee over here. I want you to take your time. You're going to roll over onto your back and scoot towards the foot of the table so that this part of your head is actually on the table, not on the face cradle. Okay?
Okay.
Okay. And make sure to pat the face cradle so they know what that is. Not everybody knows that this is a face cradle. All right. You take your time. Now, with this, I'm pinning one thigh here, one thigh right here near the glutes, okay? Make sure that you have a wide basis. This way your sheets don't go anywhere when they are turning over, okay? When you lift, lift just a little. Make them work a little bit so it's not just, hey, there you go, okay? All right, Randy, you take your time. Go ahead and roll on over. There we are. Now, yes, their face is going to be exposed when they do get down. So, from here, we drop this end, pick it up, roll alongside, and unmask the client. Okay? Again, holding, we switch, draw across the top, and expose. If it is bright like it is now, usually it won't be in your room. You can simply take the pillowcase, you can fold it one more time so it's nice and thin, and right across the eyes. Easy. At this point, you're going to remove this face cradle. You should, in your working space, have your stool available. So you can put that right on there. That will stay until you're ready to work the neck. At this point, you are ready to begin the second half of your massage. And I like to start from where I left off, which is the legs. All right, so we've learned how to transition the client from prone, face down, into supine, on their back, on their spine. Now, let's learn how to take it from when they're in supine, on their spine, into prone. So the first thing that we need to do is obviously make sure that they have a face cradle to get their face into. You should have your face cradle nearby. Now some clients with longer hair will have their hair hanging down in front of your connection spot. Super easy fix. Go right beneath the bottom sheet, pull it and their hair right up so that you can easily put the face cradle in. Right on in. Make sure to get their hair out of the way so that you don't pinch it when you are placing it in. Make sure that your pillow is in the appropriate place so when they lay down, their face isn't touching the cold plastic. Okay? From here, you will do the exact same speech in reverse. All right, Randy, so what is going to happen is we are going to take our time. I'm going to pin this side of the sheets to the table. I'm going to give you a little teepee over here. I want you to very slowly onto your stomach and scoot up so your face is actually in the face cradle, not on the table. Okay? I'm going to go ahead and take your bolster out so it's a little bit easier. And again, all the way under. Lift up. Slowly let their legs down. Do you have any questions?
No.
It's very important to ask them so that way they have a chance to communicate back with you. Get this top fold out of the way so that you can use it to cover over. Go ahead and grab one at the shoulder, one directly at the hip, and say, okay, take your time. Follow them up, unfold that sheet, and then cross it over neatly so that it's even and flat on the client. From here, again, first thing that you do is bolster. Go ahead and reach underneath, grab that bolster, right underneath where the ankles meet. Directly underneath. Is that comfortable?
Yep.
And then you are ready to transition into whatever area of the body that you have to work on next. All right, once you have successfully transitioned your client into the supine position, a couple of things. Again, we always use a bolster first. Randy, would you care for a full or a half bolster underneath your knees?
Full.
Full. Go ahead and grab. Again, we go directly underneath. Now you can see where the thigh is, you can feel where the knee is, and you know where her feet start to transition up. The easiest way for me, again, is just use one hand directly under the knees. And make sure you get both of the legs in one fell swoop. Right underneath. Lift up. Make sure that it's even. Randy, are you comfortable?
Yes.
Thank you. Now you've got this underneath, their back is supported, and you have an option to work better into the knee area without actually causing any harm or hyperextension. At this point, I usually start my massage with where I left off, the legs. All right, now you've got the bolster in, it's time to start working the legs. So again, easiest way to do this is make sure the sheets are even on both sides so you don't have any lopsidedness happening. Grab the entire blanket, just the blanket only, fold right up, and if you need to cross hands, you certainly can. Pull that right up to the top of the hamstring line, or excuse me, the quadriceps line, and this way you can access all of the leg, not just a little bit of the top part of the leg. All right, so now that you have the blanket set up, we're going to go ahead and drape just one leg. Again, easiest way to do this is to work from the side of the table, not from the foot to the table. So make sure, again, you're facing your client. one bunch at the knee, one at the ankle. Simply roll up in this motion, which creates an even tuck for you. We have the lower leg exposed, just the drape in the middle between the legs. Now again, we have this kind of cluster of sheets. You don't want to tuck all of that underneath and have them feel uncomfortable. You want to get one area. So while we do that is grab the entire cluster, have that hand stationary. Pull towards the center with your other hand until you find the edge of the sheet. Once you have that, go ahead and make that scissor motion. This way it's an easy scoop underneath the leg. Rest your hand on the inside of the thigh, right above the knee. We're going to expose half of the thigh so it's easier to tuck. And in one movement, you're going to use the hand that is not holding the draping to support the leg. All right? So we scoop right from the calf, from where knee and elbow meet. This way you have control of the leg, and while you're lifting up, you tuck right under. At this point, you'll have your arms crisscross. Simply transition the weight of the leg to your inside hand. Take that sheet and pull directly up. This way, you have the entire leg exposed, and with an air gap that's remaining, all that you do is tuck right underneath. Now you have the entire leg exposed in about 5 motions. When I do it in regular speed, not step by step. Again, we've already put the blanket up on the client. 1, 2, 3, 4. You've done your massage on this leg. Easiest way to get it back to where it once started is just do everything in reverse. Make sure to do your finishing strokes, and when you are ready, make sure to stroke down around the leg so you're not stabbing in and pinching the client's skin between the table. Right? Make sure to scoop up. Again, we hold the leg right under the knee so you have full support. This sheet that you've tucked underneath, you're going to bring directly to their foot on the inside. Right, holding it tight. When you've gotten like this, simply hold and pull. There you go. Show you what it actually looks like in real time without having to explain it. I've done my leg massage. And at this point, I can transition to my next leg, or if this was the last leg, pull down the blanket. All right, now we've completed the massage, we've draped the leg. It's time to go to the other leg. Now, again, we keep contact with the client in transitioning. When you're here, same process, different side, just different hands. Again, one at the ankle, one at the knee. Expose, find the edge of the sheet, halfway up the thigh, hold, pull. Make sure to straighten out the sheet so it's not a crumply mess. And again, tuck underneath so that there are no air exposures. At this point, you can finish your massage. Again, when you're done with your massage, we scoop upward instead of pinching into them. Cross the arms so you have the low leg in one hand. We reach, and with this bottom sheet that you've tucked through, again, we hold it so it's nice and tight against the inner thigh here. Pull it down to the foot. Trade. Boom. Now since this is our second leg, we need to make sure to get the blanket done. We're not going to grip right over the chest or right over the genital area, obviously. We make sure to find where the edge of the blanket is on the side. Run across and simply pull down. All right, now that we've completed the lower extremity massage, we're going to go ahead and transition into upper body. Now, again, we want to make sure to keep contact with your client right along the side. Now you can feel if their arm is down to the side right when you get by their hip, or if they have it on their tummy. Oh, it's not there. Imagine that. I'll have you start, thank you, just like that. So we transition across the arm, and we obviously don't want to expose their chest while we are bringing out the arm, because these sheets are slippery, they can make exposures. Easiest way for me is pin the sheets directly to their shoulder, and right underneath the sheet, follow down. Now, if you feel the arm there, you can simply guide yourself out of the way so they don't hit your thigh. And once you reach up, go right over. Okay? Now this is good for just basic general arm massage, but if you're going to start working into the pecs, you need to make sure that the drape is a little bit tighter. So how I do that is, I make sure that my bottom fitted sheet is secure by, again, placing my leg against it. From here, side tip, if they have shoulder, elbow, or wrist injuries, don't just hold their arm up like this. Ask them to assist you, okay? On a healthy client, though, this is totally normal. To get a good tight drape, you're going to simply lift the arm, have right against their body, your other hand, your tucking hand, roll them slightly, and make sure that it gets right under the shoulder blade. Okay? This way, when you are working, nothing here is going to be exposed. Okay? When you are done with this, first thing you can do is pull directly out. Second thing, right here, you simply transition, and you can say, okay, you can put your arm back. Make sure to communicate with your client so they know what you are doing. Now the second scenario is if they have their hand on their stomach like this. It's very easy to ask your client for their assistance, and you're not being a bother unless they're sleeping, of course. Now, I know that her hand is not right here for me to simply grab and pull. So I say, all right, can I have your arm, please? And when they give it to you, again, same procedure. Make sure to pin and roll them over, and good to go. You can go ahead and do your arm work, and then again, we simply pull along so that it remains tight. This way we're not lifting the sheets up, okay? Make sure you can say, go ahead and put your arm back to your side. Thank you. And make sure that they don't have any air pockets, so smooth the sheets over when you're done. Now we're going to try it without using any verbal commands, because, hey, sometimes your clients do fall asleep. So, same transition, we went from lower right up to upper body. We're going to pin the sheet against the shoulder, simply reach under. When you have their elbow, you can simply tuck that out and lay it down. Okay? Again, this method, you're just grabbing at the elbow so their hand, their entire arm, follows through with you, and then holding against the table so the sheets don't go anywhere, and right back at their side. Once you're done with that, again, if you don't want to wake them up and say, hey, put your hand underneath of the sheets, you just go ahead, pin, grab out, and transition for them. Boom. Their hand goes back to their stomach, to their side, wherever they're comfortable. At this point, you can transition to the other side. Now, make sure when you are transitioning, you don't lose contact, but you also don't go over their throat or over their chest. Easiest way that I find to do this is to know where the collarbone lies. If you follow the collarbone, you're out of the range of their throat, and it helps if it's exposed right down to the sternal manubrium. Okay? Go from the shoulder, start walking around, watch what you're doing right across the collarbones. Again, pin, other side, you follow down, find the elbow, and you're ready to work. Again, if you need to work into pecs, you're going to go ahead and lift their arm, lift it so they roll, tuck underneath, and back. Easy enough, right? Pull out, pull up, pull across, and then you can guide their hand back underneath. Easy. Another option for you to transition from side to side, if you don't want to slide along the collarbone, you can go ahead and take a moment for grounding in between. So we start here, we walk right up, place both hands, and that way you can give a little pressure downward. Take a minute to ground yourself. Once you've completed, you have your hand there already. And again, transition right into the arm. All right, so now we have finished with our arm draping, and we want to transition to our final area, which is the neck and the head, if you haven't done that already. So an easy way to do that is keep contact with your client. Go ahead and have your stool ready for you to sit down, make connection with your client on both sides. Now again, we don't want to just stab in. We use a scooping method so that we get their hair out of the way so we don't pull it there, their neck. Pinches don't feel good, okay? So transitioning, scoop underneath. We can get their hair out of the way if they have a bundle of it underneath. And this way, you can transition right into here. Now, as you'll notice, this sheet kind of comes over, and it doesn't allow us for full work directly to all the connection points. Now, an easy way for me is grabbing on the side of the sheet here and simply pulling down to expose just the top of the shoulder right to where their collarbone is, okay? You can go ahead and give a tuck underneath so they don't feel exposed, and also so air drafts don't get in. And again, you can work directly in this area, and you can work from top of the neck all the way out to the shoulder without having any catch-ups on the actual the draping. Once you have completed your massage, you want to make sure to untuck, do your finishing strokes, whatever you happen to do. I like to go from head to toe and make sure that they know it's the finalization of the session. At this point, you are ready to say, that is the end of our massage, thank you, and give your final greeting to the client. All right, now I've completed my massage. At this point, you want to make sure to do finishing strokes and do your final greeting to the client so they know that your time is over. And it's a nice transition from going from restful massage into back to the real world. Going to be our time today. Are you feeling okay? Mm-hmm. Excellent. A few things from here. First, obviously, I'm going to step out of the room. I want you to take all the time that you need with getting up. You may be a little bit out of it. You may be a little bit dizzy. So make sure to take your time and sit on the table before you actually do stand and get dressed, okay? From there, I'll meet you outside. We'll go over a few things that I found during the massage and give you a few tips on home care. That way you have an idea of what to do in between sessions, okay? Any questions? No. All right, I'm going to remove this bolster for you. You just go ahead and relax. And again, I go under both sheets. Go under the most easy and weightless part. So in this scenario, it would be her lower leg, because lifting this way is a lot easier than lifting this way. Okay? Lift right underneath their knees, pull out, and slowly let their legs down. This, again, doesn't go on the floor. It goes directly underneath your table in the holding area. Make sure that their linens are nice, and say, you take your time, okay? Okay. Excellent. Go outside, close off the curtains for your client, and then you'll meet them and give them your final paperwork and your final recommendations.
like a factory line. I'll ride across the park, backseat on the 79. Wasted days you've come to pass. So go, I know you would not stay. It wasn't true, but anyway, pollination, yellow cat. You walk up the stairs, see the French kids by the door. Up one more flight, see the boot on the second floor. Call, run.
Let's get it started in here.
And the bass keeps running, running, and 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 running.